On October 30th, town meeting will vote on two proposals recommending ways to allocate funds received from the state and the Boston Children's Hospital to address youth mental health and the opioid crisis. Municipal producer Yushao Yuan has more.
Needham Youth and Family Services proposed using the initial $400,000 payments from the Boston Children's Hospital for two positions to help the community address mental health challenges. The first position, an outreach clinician, will divide their time between several locations, including the library, YMCA, Park and Recreation, and the Needham Housing Authority as needed.
They would provide on-site mental health counseling. They would be able to help support families with case management, help connect them to resources.
The second is a community training coordinator who will train town employees to recognize and manage mental health cases.
Right now, there's a big push that we're doing for mental health first aid and training adults, and actually doing a lot of training at the high school. So really trying to push that training initiative to get Needham to be a community that can really, as a whole, respond to mental health challenges when they're seen.
These payments were agreed upon by the town and the Children's Hospital as a condition for allowing the medical facility to operate as a special permit use. The Children's Hospital is expected to continue annual payments of $200,000 after occupancy permit is issued. Each year's payment will require appropriation by town meeting. The Opioid Settlement Fund is part of an agreed amount reached to settle lawsuits brought by multiple states against the nation's major drug distributors and manufacturers. Needham will receive approximately $1.8 million over the next 16 years. Last May, town meeting approved the establishment of the Opioid Settlement Stabilization Fund to receive future payments and allocated the initial $217,000 payment to the fund. Needham Public Health will propose using $145,000 at the October special town meeting for the following purposes: $90,000 to hire a professional who will lead community discussions and develop a 5-year strategy on how to utilize the Opioid Settlement Fund; $3,000 to purchase sandboxes throughout the town.
This will get us close to 10 or 11 sandboxes that allows us to put Narcan into the box. They are just locked with a little key on top that anybody can access and take out, then they can use in emergency.
The remaining $52,000 will be allocated to hire a peer recovery coach who will collaborate with other community groups to identify residents with substance use problems and offer peer support.
It will help them to develop a personal plan of what they will do in their recovery, or what things will look like. It will give them personal relationship of somebody who has peer experience in their own recovery as to how and best to support them throughout this process.
For the Needham Channel News, I'm Yushao Yuan.